So before going on to the oxygen delivery system, these are all, you would have seen these cylinders in our oxygen, in our hospital, isn't it? So all these are nothing but oxygen storage systems. So this is a compressed cylinder, and there are some liquid oxygen cryogenic cylinders. I have not put the picture here, just mentioned. And this is an oxygen concentrator. Basically this is like a portable one, where the atmospheric or the ambient air will be compressed and concentrated, and that is given to the patient. So this is an oxygen concentrator. What we see in hospitals is this, the compressed gas cylinder, black cylinder with a white holder. So this is the compressed gas cylinder. Coming to the oxygen delivery device. So far I was telling in between low flow system, high flow system. What exactly is a low flow? What exactly is a high flow? When will I start on low flow? When will I start on high flow? We will see. Okay. So what is a low flow? Low flow means, you know, the child's inspiratory rate. If you are going to start a system which is less than the child's inspiratory rate, or if you are going to start and you are aiming at FiO2 less than 60% only. Okay, I don't want more than 60%, means it is a low flow system. Okay, examples of low flow system I will tell you, you will be able to understand better. Nasal cannulas, nasal catheters, simple face mask are all examples of low flow system. Okay, so nasal cannula and a simple oxygen mask or a Hudson mask is going to be a low flow system. Whereas high flow system is more than the child's inspiratory rate. I am going to give it a high rate, high flows. I am going to give like your high flow nasal cannulas, HFNC or a HHFNC. So all these are high flow systems where you will be able to deliver also more than 60% FiO2. Okay, so more than 60% FiO2 up to 100% FiO2 I will be able to deliver in a non-invasive method. And example will be a HFNC and a non-rebreathing mask. Okay, this is the basic difference between a high flow system and a low flow system. Definitely you all should know. As residents, we should definitely know this. Okay, coming to the first most simple one, that is a nasal prongs, nasal cannula. Everybody has expertise with it, isn't it? Very, very simple method of administrating it. So everybody have done it, and we have seen that there are many sizes, many shapes available. So just look at the images here. So there are 4 different shapes. So soft tip, straight tip, curved tip, flared tip. So these are the different shapes, many different sizes based on color. Some manufacturers, they give different colors, some of them they mention. So this is for premature, this is for a term neonate, this is for an infant, this is for a pediatric. So the depending on the colors will vary. Okay, so nasal cannula, what you have a soft tubing. This is a soft tubing, and then you have soft prongs at the end. Okay, and various shapes and sizes are available. You have to apply these prongs into the nasal cavity, and it should fit well inside the nostril, not very tight, not very loose. It should be of the right fit. And when you are going to use a flow which is more than 4 liters per minute through a cannula, you should always use a humidified oxygen. This is an important point here when you are using more than 4 liters per minute. But most instances, what we do, nasal cannulas are less than 4 to 6 liters per minute, not more than that. So for a newborn, how will you start?